the Asclepian. Well, one of the first things I want to say about healthcare was that it was both regional and transnational. If you did not need to travel to a major shrine of Asclepius or of Hygeia, you could, of course, just simply visit a smaller shrine in your area, in your city, or, of course, it was always an option simply to pray to your household gods within the confines and the privacy of your own home. So it was both regional in that people had the option of remaining in their own space, but it was also transnational in that when you look at, this is only part of the Roman Empire, right? Here's our Asclepian here. We have evidence that people traveled from all over the Mediterranean in order to seek a cure at the Asclepian. In addition to being both regional and transnational, healthcare was also multidisciplinary. I think the fact that an individual could seek the healthcare from both a secular physician but also from a priest or priestess gives us a really good indication that both of these levels of healthcare are taking place simultaneously. And we can see that not only from the mosaic, but from other pieces of evidence as well. So let's look at this one. Where's my cursor? Let's look at this one here. So here we have a young person being attended to by a physician who is dressed as Hippocrates, but then we also have here Asclepius standing over to the side, making sure that everything is proper and right. So we have every reason to believe that this image is an indication that both fields were sought in the cure or care of this individual here. And as well, over here in this image, we see a doctor attending to a patient here by perhaps cauterizing something or making some small incision, or it does look like there's an instrument there, so it's hard to tell. But then also notice what's going on over here. We have a couple of things happening. First of all, this person is either reclining or sleeping, which means that this individual could be attending to them in a dream. We don't know. But then also notice here, oops, where'd my cursor? There's my cursor. Notice this. It's a snake that's reaching up from behind and clamping its jaws firmly on this patient's shoulder. Not necessarily because they're intending to harm, but I would argue it's likely that they are receiving some form of miraculous healing. So again, we see both disciplines represented in these images. So healthcare, in addition to being transnational and regional, also could be multidisciplinary. As well, healthcare was also high-tech. There was a process, there was a procedure by which you would receive treatment, especially at formal places like the Asclepian. The process would include an examination. A physician or a priest-physician would look at you and talk to you and see what it is that you could or your body could tell you about your health. There was a process of purgation. So when entering into what is considered a holy and sacred space, you would need to purge yourself of particular, vile things that can sometimes impact our health. So a person might be fed things or given an enema or some other type of medical procedure that would allow them to either vomit or excrete things that were making them ill. And this is, who hasn't done a cleanse, right? I mean, this is normal procedure. As well, one form of the high-tech healthcare in antiquity was incubation. So an individual would be isolated from others for the purpose of rest. And of course, this is exactly what an incubator does in a neonatal clinic. You isolate the vulnerable, and you restrict light, and you restrict noise, and you restrict the possibility of other diseases. And so incubation was one way in which someone who is ill would be given the opportunity to rest and perhaps be visited during the course of a night or in a dream by the divine.